Good afternoon and welcome to our webinar, Tracking Reforms, Fixing Health System. Today, we are introducing the Observatory Health Reform Tracker. We all know health systems reforms are very complex. There's so many options. Sometimes it's even very difficult to define what the problem is we need to fix. There are plenty of stakeholders that are exerting pressures pointing in different directions at the same time, and policymakers sometimes don't know how to react to this. You hardly have the time to see what other countries are up to. What are their reforms? Maybe you look at one or two of them, but not really systematically, and you strip yourself of the experiences coming from other countries. And this is exactly where the Health Reform Tracker comes into the pictures. It provides you with systematic coverage of other countries' health systems reform. It has a long back catalog of health system reforms and a system of categories that prompts you to the relevant reforms. So in this regard, it's an analytical tool, but it has at the same time really practical uses. It opens up perspectives and it makes experiences from other countries accessible. It invites to comparison and it helps to learn from each other. And on another note, it's actually also a look under the hood of the observatory, because the Health Reform Tracker is very much based on our health systems and policy monitoring network. Now, so much about the introduction. Today we have excellent speakers talking about the tracker and its uses. We have Kate Polin, my colleague from Technical University Berlin, and it's a great pleasure to me because in October 2021, Kate was already presenting some sort of predecessor of the Health Reform Tracker, and we had super positive feedback to this particular webinar. She will give you a live demonstration of the tracker. Then we have Reinhard Phoebe Dunn from the Health Foundation. She will zoom into a particular experience of reform and show, the scope for learning from each other. And in a similar vein, Reinhard Busse will talk about the health hospital reform in Germany. This will be followed by Vesna, who will look at it from the policymaker's perspective, a very practical perspective. And last but not least, Dirk van den Steen from DG Santé will tell us how the Commission is actually using the Health Reform Tracker. Now, just a couple of words regarding the housekeeping. Please use the chat box. We want to collect your comments, your questions, your insights, because at the end of the session, we have a panel discussion and we will feed back your comments to the speakers. Please be aware, this session will be recorded and it will be very soon on our YouTube channel, so you can look it up again if you want to delve a little bit deeper. Now, it's time to introduce my wonderful colleague, Erica Richardson, who will monitor the chat box, but who will also start right now, actually, the audience poll. Erica, floor is all yours.
Thank you very much, Matthias. Thank you very much. Yes, just a quick warm-up poll for you here, just to see where we are. Just a quick question. In your opinion, which two health system challenges do you think were the most pressing across 2023 and 2024? I'm assuming that you haven't already had a peek at the Health Reform Tracker, but it'd be just really interesting to see what your opinion is on this. And we'll come back to the results of the poll a little bit later during Kate's presentation. Thank you very much.
Erica, thank you so much. So there are already 6 categories up for choosing, and we are quite curious, what the audience view on this is. So, but before we get back to the poll, as you said, Erica, I would like to invite my colleague Kate Polin and to give us a little bit of an overview on the Health Reform Tracker. Kate, the floor is all yours.
Hi, everybody. It is a pleasure to be here this afternoon. I actually have two tasks today, which I aim to fulfill succinctly and informatively. First is to briefly introduce the Health Reform Tracker, as Matthias suggested, and to give a bit of a background and an overview of its structure with a live demo. And then to present a little taste of the trends and insights that can be gleaned or enabled from the tracker with a link back to the results of the poll. So just to give a sense of the background, as Matthias had said, it's actually the Health Reform Tracker of the Observatory is an outgrowth of an annual exercise that our Health Systems and Policy Monitor Network has done yearly since 2018. The HSPM network, as we call it, comprises health system and policy experts from 32 countries worldwide, so 30 within the WHO European region, plus Canada and the US. And since 7 years, we have asked experts from this network to report on the top 3 health reforms in their respective countries for a given year. This has resulted in a repository or a database of over 630 reforms, which is the backbone of the tracker. And we gather information like content of the reform, objectives as stated in national policies documents, but also aligned with the health system, WHO health system, intermediate objectives and final goals, policy measures that are used for these reforms, including is it legislation, a directive, policy originator, so often linked to policy measures, but was the policy originator the Ministry of Health, a different executive agency, maybe the Parliament, and implementation status, to give you a sense of all of the data points that we collect for the reform. And this tool, the Health Reform Tracker, uniquely allows users to survey trends across countries, in a country, within 1 year, across years, and also by all of these data points. And it's supported by visualizations and qualitative information for further contextualization. Here you can see in the top right, there are sort of 4 main pages that the tracker is structured around. We have the overview page, the countries page, the reform page, the implementation page, and then there's an about page. It's important to note that we land on the landing view is the first view of the overview page, and it actually shows 11 clusters. It's important to note that when we collect information on reforms, one main methodological step that the observatory undertakes is to allocate each reform to 1 or 2 clusters, which are divided into health system functions in this purple and blue shading, or care areas in the orange and yellow shading. These clusters are actually based on 3 frameworks: the observatory's HIT template, the health system performance framework from the WHO and the observatory, and the WHO's health systems framework. Clustering happens in an iterative process with 2 observatory researchers and our HSPM country experts. Here you see these clusters. This overview page allows you to explore by cluster and country and year sort of overview trends. So let's say we take financing, coverage, and resource generation here. You click and it takes you down here to financing, coverage, and resource generation. And it takes you first down to a map. The map outlines in the darker gray the HSPM member countries. And those that are highlighted in blue had, for example, in 2024, a reform or more that were active in this chosen cluster of financing, coverage, and resource generation. If you're interested in another year, just click on another year, 2021, and it will show you the countries that are implicated or involved in that cluster for that year. If you click on animation, which I won't just now for time purposes, we can take you across a journey through time in terms of which countries are involved in coverage and resource generation reform areas. Another option here on the overview page is if you click on the heat map, which gives you a numerical overview of which reforms were reported by HSPM experts to be coverage and resource generation reforms. those countries, for example, Bulgaria in 2018 had 2. So those countries with more than 1 reform in a chosen area will be shaded in blue. Otherwise, it's in gray. Interestingly, if you want more information on, say, Cyprus's reforms in 2020 on coverage and resource generation, you can click and the name of the reform and its other cluster allocations will come up. And if you want more contextualization, a calling card of the reform will come up with all of the information that's been collected on this reform. We also link to the HSPM website where we regularly update on health system reforms, give a little bit more analysis. So each reform is linked to an update on the HSPM Monitor website. Another helpful view here is the chart view. Here you can see the evolution over time of a particular reform in relation to the other clusters, reform clusters. So here you see coverage and resource generation in relation to all the other reform clusters that are in gray. You can either look at this in terms of absolute number of reforms or as the share of reforms. That's the overview page. If you go to the country page, this allows you to look more specifically in depth across time in a particular country. Here you see if we choose Germany, for example, you get a chronological list of all reforms reported by HSPM experts over time. And if you click here, again, the reform calling card comes up. You can also start to track implementation status of the reforms as reported in a given year as of date of most recent data update. So our most recent data update was December 2024. And as of then, here are the reforms that have been fully implemented or abandoned or are ongoing. This takes us to the reforms page, which enables an even more in-depth investigation of reforms by all types of the data points that I have already referred to. So policy originator, policy measure, those sorts of things. And you have helpful downloadable figures for this. If you go into advanced filters, for example, and you just want to see the distribution of 2023 reforms, you can choose the year 2023, and you can see the distribution by cluster, by type of reform or policy measure, policy originator, health system objectives, as reported by the HSPM experts. And then this matrix also gives you a sense of the clusters overall that are involved in the reforms for 2023. And then the specific list, which again, if you click, will call up the calling card. We also helpfully have a free text keyword search. So sometimes, as Matthias mentioned, reforms are often very multifaceted, and we've allocated 2 types of clusters to reforms, but say chronic care could be a cross-cutting theme, and you could go in and you could want to see if and where chronic care appears. And you can check, and that will also give you a sense of where chronic care. Sometimes it can be in specialized care cluster, but it might also be just allocated to coverage and resource generation. So this gives you a better sense or ability to identify cross-cutting themes that are of interest to yourself. And then we have the implementation view, which allows you overall to look at the implementation status of reforms as reported in a given year, with contextualized reasons for why it's been abandoned, which can be very helpful for policymakers. And then we have the About page. But I would encourage you all to explore this yourselves. And Matthias, back to you.
Great, thank you so much for this first installment of your presentation. I think it was a great presentation, but also what an amazing tool, and what a wealth of information. 630 reforms, 7+ years, and so many ways to access it. And it's not superficial, you know, if you want to know more about it, you just click on it and you are referred to resources and analysis. That's really fantastic. And also, you just demonstrated you're not shying away from the complexities, but some reforms are difficult to assign just to one category, but you have clusters and so on. That's fantastic. Erika, please tell us, what does the audience believe? What are the most important, the most frequent reforms at the moment?
So yes, hopefully you can see, hopefully it's sharing the results. Yes. So yes, these are the poll results. And interestingly, governance of care coordination and integrated care systems, along with, to a lesser extent, financing of hospital care, are what people thought would be the most pressing sort of health system challenges across 2023 and 2024. Now, that's what people felt were the most pressing challenges. But what's also really interesting is whether or not those were considered the most pressing challenges by the policymakers and whether or not they sought to address them with their reforms. So, Katherine, I'm going to hand back over to you so you can tell us the findings from the Health System Reform Tracker. Thank you.
Thank you, Erika. And indeed, everyone seems to have a pretty good pulse on the most pressing issues in their in health systems these days. So I'll first, so what we've decided to do is present kind of trends in health reforms since 2020. And here we have, and then we'll go a little bit more into what you guys have identified as the top 3 most pressing issues: governance and care coordination and integrated care, financing of hospital care, and care coordination and digital health. So here, while this figure is not from the tracker, it's built on information from the tracker. And here we map out the top 3 reform areas or clusters from 2020 to 2024. And in this time period of 5 years, you see that governance is a main area of reform across the board. In 2020, it was followed by financing, purchasing, and payment, and digital health. This is related quite to the first COVID years, where governance was a lot about communicable disease control, centralization of health system powers, including information sharing. And then you have the sense of purchasing and payment, especially for new digital health services, reflecting the health systems situations that they found themselves in terms of introducing new digital tools for disease or infectious disease control management, but also to ensure continuity of care. And then you have in 2021, governance followed by financing, coverage, and resource generation, primary and ambulatory care, and then also purchasing and payment. In terms of coverage, we saw in 2021 and actually in 2022, kind of an expansion of public coverage of services, costs, and for populations. This was involved in new COVID-related services, but not always. There was an emphasis on vulnerable populations, for example. And then this sort of sense that primary care is so integral to health systems resiliency and sustainability, and for ensuring adaptability to new crises and for continuity of care. And you see where primary care becomes a salient reform cluster from 2021. And then meanwhile, in 2022 and 2023, health workforce as a major fault line, as underscored by COVID, became a reform area of major activity. And then, indeed, care coordination and integrated care has become, which is an integral component of WHO's definition of primary health care, became a salient reform area in 2024, but really linked to this idea of strengthening primary care as well. And so overall, for these 5 years, we have governance, financing, purchasing, and payment, and financing, coverage, and resource generation as sort of the main overarching clusters of reform activity. But if we look at 2023 specifically, and their main cluster combinations, which the poll was really trying to get at, we see some cross-cutting themes. And so governance, financing, purchasing, and payment, and health workforce and primary and ambulatory care were important care clusters. And many governance reforms in 2023 were really only governance reforms looking, and we're talking about national health strategies like in Malta and Portugal. There was a lot of decentralization in contrast to the centralizing effect that COVID had. There was some attempts at devolution, for example, in Finland and in Italy. And many of these governance reforms were focused on improving efficiency, access, and quality of care. If we look at health workforce, a lot of them also were single sort of reform cluster areas, as we call them, and they were strategies, changes to training and competencies. Many focused on improving access and accessibility and retention via new payment approaches. Indeed, many health workforce reforms were also complemented by financing reforms, as we see here in terms of purchasing and payment. And then we also have that hospital care, which is one of the poll results, started, this is private, so excuse me, and then primary and ambulatory care was also sort of a nice mix with health workforce. But if we look at hospital care, which was one of the main reform areas, we see that purchasing and payment was indeed one of the main issues as reported by the health system experts of the HSPM network. And then there were several others that I won't go into for time, but in 2024, we also see that governance, care coordination, and coverage and resources generation were main areas. And within care coordination or governance, specialized care was a main reform cluster. We're talking about plans and strategies for palliative care, for example, and reproductive and women's health, for example, or rare diseases in vulnerable populations. These were often linked as well to coverage reforms. When looking at hospital care, following on from the financing reforms from 2023, we also saw major governance reforms in hospital care. And then we also have hospital care often linked again to purchasing and payment reforms. Following on from 2023's care coordination and governance, we also see that we have governance and care coordination here. Several others also were involved, but as you can see, these results do confirm that governance and care coordination, especially in 2024, was a main issue. Financing and governance of hospital care as well. And then this sense of care coordination and digital health does come up as a cross-cutting issue. It's not a main area because it's really sort of populated throughout to ensure continuity and access to care. And so what several themes do emerge, and just to reiterate, governance remains a top cluster. We're looking at coverage and resource generation as a main cluster of reform activity. Health workforce reforms since COVID have been very salient. We've switched from primary and ambulatory care from COVID to hospital care reforms, but really with an emphasis on coordinated and integrated care. Specialized care has been increasing, probably also related to Roe versus Wade's overturning. We're looking at reproductive and maternal and child health a lot. There's been an expansion actually of prevention and public health services. Digital tools and infrastructure are really important in terms of care coordination. And again, access and efficiency issues are used as a rationale behind many of these reforms. That's it from me. Matthias, back over to you, and I look forward to the conversation.
Great, absolutely fascinating. Thank you so much. And I think our audience wasn't so bad. I think the governance came out the first actually in the audience poll. And of course, what you were presenting is analytically totally fascinating, but I think it also came across that it has really practical value, because if you see what other countries are currently or only recently doing, that they are probably running similar reforms, you can better connect, you can see what they've done. Maybe you can even create some sort of community of practice to exchange first-hand experience, you know, so that's absolutely fascinating. And now we go one step beyond the tracking. We really want to zoom into the scope for learning, and it's my great pleasure to introduce Phoebe Dunn from the Health Foundation. She is Senior Fellow in the policy team in the Health Foundation, and she will talk about the NHS England reform. Phoebe, the floor is all yours.
Thanks, Matthias, and hello everyone. It's really brilliant to be here with you all this morning. I'm going to provide a speedy spotlight on the NHS in England. Health is, as we've discussed, a devolved matter. So I'm going to kind of set the scene with a bit of the current context and then give a couple of examples where I think there's kind of opportunities for greater international learning. So current context, we have a Labour government elected last summer, inherited a National Health Service under immense strain, long waits for care, targets being routinely missed, low public satisfaction, and really extreme pressures across the system. More broadly, public finances are constrained, and like many health systems across Europe, facing pressures ahead from labour shortages and a population kind of ageing in poor health. This new government has promised to recover services and transform the NHS. In doing so, it's emphasised policy change or reform, kind of overinvestment, and gone so far as to say it's reform or die for the NHS. A 10-year health plan is currently in development. That's due later this year. And this is being framed around three kind of shifts that the government wants to achieve. The first is more community-based care, so shifting from hospitals to more care in people's homes and in communities. The second is kind of treatment to prevention, so greater disease prevention. And the third, analog to digital, so greater use of digital technology. And there's lots of potential learning from other systems across these three shifts, and then thinking about how policy levers might be reformed to support these ambitions. And that's, I think, where the tracker can also come in really helpful in identifying some of the most relevant countries to learn from. So my slide can probably come down now. I thought I'd just highlight two examples where there are opportunities to sort of learn from each other. The first being this idea of shifting care from hospitals to communities. This is a really long-standing policy ambition in England. But when you look across activity, funding, workforce, very little progress has actually been made. In fact, the health system has become more hospital-centric over time. So where have other countries had more success, and what can we learn from that on the kind of achieving more of a balance of spending? What policy approaches have been used? What are some of the trade-offs? Colleagues at the Nuttall Trust here are doing some interesting work on this, but there's kind of definitely more to learn there. And then the other example I thought I'd draw on is something we're doing some work on at the foundation at the moment, which is payment systems. There's a long history here of learning from one another, and there's sort of general agreement in England that the current system for reimbursing providers for the care that they provide does little kind of incentivize some of these broader policy goals around prevention, integration, shifting away from more of a hospital-centric model. And we know there's lots of experimentation and evolution across Europe as new models of care are developed alongside payment approaches for these. So those feel like two kind of areas where there's lots of potential. And in this context, I think that learning can help us understand how to approach similar challenges in terms of what policies might be used, how they need to align, what resources are required. Secondly, on kind of building the evidence base on what works, what are some of the enablers and barriers, the trade-offs, what are some of the unintended consequences, and how long might it take to see some impact. And then thirdly, I guess more broadly, just showing kind of the art of the possible and demonstrating that progress can be made on some of these quite knotty policy issues that we've kind of grappled with in England for many years. So I will stop there and hand back to you. Thank you.
Phoebe, thank you so much for this. I think the scope from learning from each other became quite clear, especially when you disaggregate the big reforms into smaller chunks, you know, and then I instantly see, you know, how the reform tracker actually lends itself, you know, to zoom into it and to see, oh my God, France did something, Belgium did something, Italy, some regions did something on the same thing. And sometimes, you know, it's about the intervention, the reform you want to see, but sometimes it's also the implementation strategy, because what we want to achieve is quite clear and the interventions are clear, technologies are clear, but it's so hard actually to implement. Thank you so much for this demonstration. And I would like now to turn to Reinhard Busser. I don't need to introduce him. Reinhard Busser is professor at Technical University Berlin, and he has been one of the most prominent proponents or supporters of the hospital reform in Germany, which is one of the biggest reforms in decades actually, and was passed just before the end of the year. Reinhard, we are all very curious, and we want to hear how you learn from each other and how you would probably use the reform tracker. Reinhard, please, all yours.
Yes, thank you, Matthias. Welcome, everybody. We just heard from England, the UK, the shift from hospital to community care. In Germany, actually, the starting position, you could say, is even more complicated. We have hospitals, but hospitals traditionally focus on inpatient care, and we have a large community care, ambulatory-based sector. But this separation is one of the major problems, especially as the hospital sector is quite large. We have more hospitals than most other countries, with more beds and more inpatient cases, because if people turn to the emergency rooms, the hospital actually does not have the chance to treat patients on an outpatient basis, but puts them into beds. These many hospitals show a large variation in quality, and since the decrease in numbers of inpatients since the corona pandemic, they are also, most of them are in deficit, even though our case numbers are still quite high. So when the previous legislative period started, still during the corona pandemic, the coalition contract said that they need a government reform commission to propose a hospital reform, and so we were installed 3 years ago and came up in December 22 with a reform proposal to really restructure the German hospital sector, and this proposal was taken over by the Federal Minister of Health, and we said hospitals should be put into one of 3 levels, so really central hospital, regional or general hospitals, and local hospitals, because so far hospitals are totally unsorted and you really don't know what their care spectrum is. So we said levels, service groups, to better describe which services could be provided by hospitals, and there we did learn from each other. We copied more or less the Swiss approach with the service groups. I think many people in Germany did not know really that Switzerland has this approach. And last but not least, we proposed a shift in the remuneration, also thereby learning from other countries. We were and still are very much focused on diagnosis-related groups, and we said we need a mixture of funding mechanisms, less reliance on DRGs and more budget-type allocations based on these service groups. We originally proposed around 130 service groups, which would then be based on technical and personnel requirements. So that was in December 22, 2 years ago, and then the big quarrel started. We are a federal country, and the 16 states are responsible for hospital planning, while the federal level is responsible for the hospital financing. So more 1.5 years, there was heavy discussions. The level concept was abandoned because the state said we are not using this federal definition of uniform levels, because hospital care in Bavaria needs to be very different from hospital care in another state. But finally, in the spring of 24, it became all a bit more settled. There was a separate law on hospital transparency, introducing a web page where you can follow the quality data, and the main proposal survived that hospitals will be allocated service groups, so they can only provide services for for the services groups and not whatever they want, as it is currently the case, and that the remuneration will be changed. States still didn't like it, and I must say it also became very complicated. So the relatively simple reform from the beginning became more and more complicated. The law was finally passed in the federal parliament in October last year. Then in November there was a meeting of the states which tried to put it back to the arbitration committee between the federal level and the state level, but that failed. And so since December 24, the reform is in place. There will now be a 4-year transition period for the service groups to be divided, the new financing system to be phased in over the years. But as many of you know, we have elections the end of next week, so we have to see which government comes in and whether they will change certain elements. I personally don't believe it, because it's a very complicated and intertwined reform, which will now take time to be phased in, but will not be reversed as far as I see it. Thank you.
Thank you, Reinhard. Learning from Switzerland sounds like learning to be real rich. Very good. I really enjoyed it. But of course, you also pointed out that learning from each other has its limits when it comes to the political process. And apparently some of the states were not willing to follow the learning from other countries. But even more important, you know, that the reform, the science, the evidence behind this all is very clear. And given that this is such an important reform, you know, such a fundamental reform, it's very encouraging to see, you know, that part of it, you know, is based on learning from each other. So thank you so much, Reinhard. And I would like now ask Vesna Petrič to come on board. Vesna is at the moment the head of the Office for Cooperation with WHO in the Ministry of Health, but Vesna was holding many senior positions in Slovenia in the Ministry of Health over time, but she was also very engaged with WHO. She was in the executive board and she was a very outspoken person, and she's one of the persons in Europe who says, if we learn from each other, we need to learn how to use civil society, how to better engage with social participation. And I'm very curious, you know, to hear your account and also to see how we can link this to the reform tracker. Please, the floor is all yours, Vesna.
Thank you very much. Slovenia indeed is a country that really is eager to learn from others. And that is maybe because we are small and have limited capacity, but also because we have good experiences in learning from others. And, you know, as many other countries, also Slovenia strives to respond to numerous challenges in its health systems. And as a partner of Observatory since 2006, we have used capacities of this unique organization to support us in transforming our health system in many ways, including by Observatory providing for us an in-depth analysis of financing and organization of our health system with the proposals of improvement based on evidence that from other countries, and this later served as an input for our national health plan that was later adopted by the parliament. So we are actually using all this information to adopt something in our own country. But most of all, as a small country, as I said before, with very limited capacities in health system research, we appreciate the access to international information and trends in different areas of health system performance, including good practice, but also bad practice from other countries. It is by law in Slovenia that you must provide several examples from other countries when proposing any new legislation or strategy to the government or parliament. So basically, we are obliged in, you know, look at international information and good and bad practices. In this regard, Health Reform Tracker, we consider a very useful tool, also when taking part in international negotiations, for example, at EU or WHO, to make such information easily available to decision makers Civil servants and also to health system researcher is a precondition, this is how we feel it, for making informed decisions at all levels. We do feel that it would be very important to promote Observatory Health Reform Tracker within our countries even more, so that it would be used in all countries. There is also another side of it, our own good practice of combining primary health care and public health capacities to ensure preventive services to all, and in particular to those most in need, has also been made available to other countries. This is important to us because it is very encouraging to have some international reflection on what we do and if we do it well. Finally, I want to say, and here I'm coming to what Matthias has announced already, that there are many areas of interest, and apart from the focus on financing, care coordination, quality, digitalization, workforce, primary healthcare, pharmaceuticals, and so on, Slovenia is grateful that Observatory also paid attention to how the countries are ensuring access to preventive services and to delivery of public health functions in general. We appreciate a lot that lately Observatory helped us also in collecting information on good practices of how in times of crisis we can better use potentials of civil society and institutionalize social participation. Of course, we expect that also this area will be reflected in Health Reform Tracker with time. It is about governance, but also about transparency and accountability, and in particular about how to ensure equity in health and ensure that UHC is attained. Thank you.
Vesna, do I see Observatory books on your desk behind your left shoulder?
Most probably. I'm covered with those books.
You are really a poster child.
Yes, you do see Observatory books. Here you go.
Using international agencies, for your own purpose. And I think it pays out actually, and you are very outspoken. And thank you so much for coming on board for this webinar, and also being very clear, not to forget about civil society and the very important role civil society plays, not only just in terms of the implementation, but also in terms of having a voice and shaping policies and providing intelligence. And also, I think this is more and more important, adding to trust in the health systems and to social cohesion. So thank you so much, and very encouraging, that you are really proposing the constant and frequent use of the reform tracker. Thank you. So now it's my great pleasure to ask our colleague Dirk van der Steen. He's Deputy Head of Unit in DG Santé, European Commission. And Dirk, I can figure that sometimes your head must be spinning, so many countries, so many health systems. Some even have regionalized health systems. Oh my God, what are you doing? What can we do? How do we get an overview on all this? How can we do policies, that fit the entire European Union members? Dirk, floor is all yours.
Thank you, Matthias, and thank you for empathizing so well with our position, with the head spinning. And in this regard, I would say that the tracker tool you provided will really help us out a lot. So my unit deals, among other, with the European semester, also state of health in the EU process, where we have, among other, these country profiles that also tap into your expertise network, the same network that delivers input to the reform tracker. And obviously, where the reform tracker will help us is with the European semester, where we, since 22, actually for all 27 member states, we now have a thematic analysis of the health system. And we need to report there on what is the latest development on the ground, also in view of how are we meeting with reform challenges that we raised in previous years. And not to forget, of course, we have country-specific recommendations under the European semester. I think what it surely adds is, I saw we have implementation status, that is brilliant. It also adds extra dimension. If you look at a specific reform, you could ask, is this a consistent package, or do we need another reform in conjunction? Also, if you look at a specific reform, I saw some of the data used shown that in 2020 we had an uptake of digitalization, also procurement reforms. That is not a surprise. But then a few years later, we saw that we had the health workforce reforms. So this basically already helps us anticipating future necessary reforms. So in this regard, this is super useful. And of course, I also have to mention that with the Recovery and Resilience Facility, for which also the semester was basically the platform to roll it out, we saw how investments, the money is linked to the reforms, the conditionality. So this is super relevant in this regard. A second area where I see a direct contribution is another important EU-level process is the Joint Employment Report. It's part of the semester, but it also feeds into the social convergence framework, which, if you want, is sort of a complement or a mirroring process to the more macroeconomic imbalances process. So this has some political traction. And there too, in previous years, we have been submitting from the side of Santé on what are the relevant and recent health system reforms at national level. And everything that can be added for the analysis in the country reports of the semester, we will also be able to add for our analysis to the joint employment report. So thank you very much. Another area where I see direct contribution is in the unit, we also co-chair the Health System Performance Assessment Expert Group. And this group looks, among other, into policy relevant indicators. And of course, if we see, for instance, that in 2020 we have a surge or a wave of reforms having to do with digitalizing our health service provision, we can already anticipate that indicators measuring such progress will gain in importance. And this could directly contribute to discussing the agenda for our working agenda in coming years with the member states. And then a fourth area where I see direct added value is all the actions and the measures we support and engage in under the EU for Health program. For instance, take a joint action. We have one on heroes, on workforce. Again, if we see that there is an international trend for specific reforms, such as digitalization, and we plan our work years ahead, then we also know already that if we do something on workforce, we need to include digital skills because it is very likely to gain in relevance. And these are insights we can directly glean from the reform tracker. So thank you very much. And I can already assure you that we are, as we speak, and have in the preceding weeks been using already the tool for preparing the 25 semester country reports. So thank you very much for presenting this as a gift to the research community and to policymakers. I'll leave it at this. Thank you.
Dirk, thank you so much. I think you made crystal clear that for the Commission, for the job you are doing, country monitoring is absolutely key, and the health reform tracker is a super tool to tap into the evidence, to tap into the report, to tap into experiences from other countries. So thank you so much for this insight from the Commission and in your work. And now it's time for a round of questions from the floor, actually. Erika, how was the chat box? Was it busy?
In a very busy chat box, yes. Lots of technical questions in there, which some of my colleagues have already answered. But one question that's come up a couple of times is, what counts as a reform? How are we defining reform? So I thought I'd better put that out there so the panel can actually speak to that. But there are lots of other things as well. So, for example, do we need an extra tracker line for EU level reforms? Should the EU also have a tracker line in there so that we can see what they're recommending for member states? Or should we be linking the reforms that are happening and maybe saying, well, this is in response to an EU thing? Is there a sort of like linking back mechanism? And is that something we should be considering? And then on the more sort of like macro level, you know, are there any insights on how this tool might be useful to EU projects that are ongoing? But also whether or not we're reaching a kind of singularity in reform directions across Europe, because we're all responding to the same kinds of problems. So some quite big questions there. I'll hand them over to the panel. Thank you.
Yes, shall we actually start with you, Phoebe? And you don't need to respond to all the questions, just pick the one out you feel best suited to respond to.
Yes, thanks. Yeah, lots of big questions. I'll leave the kind of some of the ones on the tracker for others to answer. I mean, I think the kind of singularity point is really interesting, isn't it? Because often I think we compare or use country comparisons based on kind of the model they use. You know, are they this model, that model? But actually that feels less and less useful, and actually feels like there's kind of a convergence on the challenges and that we're trying to tackle and the kind of approaches being used. So I think actually the nice thing about this reform track is it opens up those comparisons and allows questions to be tackled by kind of, these broad buckets that we're all thinking about, rather than kind of diverting to the comparisons we've often used in the past. I think it's really nice opening up where you learn from and how you approach those questions. I'll pass on to others for some of the broader questions on EU stuff.
Yeah, thank you so much for this contribution. I also think that, you know, when people are using country examples, sometimes they pick out the countries they know best or the countries that suit their interest, but not necessarily systematically. And now with the reform tracker, you can look across the board, you know, and you can make a selection of countries which are really very important to this. Okay, Reinhard, please.
Well, maybe we should say there is really much more information on the website. I already put in the chat here that this is based on a very long-standing network of established institutions which have worked on the methodology for a long time, and this is the latest stage here that we highlight and make reforms more comparable. There was this question of what counts as a reform, and we deliberately leave that a bit open to say we want to catch even reform ideas. So if the network partners say there is this great idea which is voiced, which is debated, you can already put that into your list. Then it's maybe a proposal, a draft bill, then it is the actual legislation, then it is the implementation, because we are trying to capture, and hopefully my hospital reform was a good idea. So the first time we saw this in the reform tracker or on the network webpage was when the reform commission was installed with the task to develop a reform. And so then later we reported the proposal is now out. Even later it's now a law. So we take a broad view on what counts as a reform, and we even follow after, or we see up to implementation. Kate showed these colors there, whether the reform is still in the planning or preparation stage, which is whether it has been implemented or whether it has been abandoned. And so I mean, Vesna or somebody said it, you can learn from other countries' successes, but also from other countries' failures. And this is also very important, not to see great ideas, but also that we follow what has failed. Thank you.
I think it's really very useful to include the reform ideas, because as you have described in the example of the hospital reform in Germany, it takes years from the reform idea to the implementation. You were talking about 3 years of lead time in this, you know. And if you are in a different country, in Belgium or in France, and you're thinking about a similar reform, you will be happy to learn about the reform idea. Something is going on in Germany, and let's connect to these people and see what they are doing exactly, even before the reform has passed the parliament and is a proper bill. Thank you so much, Rainer. Vesna, please.
Yeah, well, what I would want to say, it's probably very different if you are from a country that is big and has a lot of institutions, or even if you are from an English speaking country, you know, UK, and you have so many documents published in a language that everybody understands. In my country, of course, whatever is published in Slovene is not accessible to the others. Nowadays it's getting better with artificial intelligence and all of this, but still, you know, not much is known about Slovenia. And us becoming a partner of Observatory and ensuring that information on our health system and its reform is available in English and comparable to other countries, to what other countries are doing, has also helped us to ensure that also within the semester, and I'm speaking to you, Dirk, you know, our country was better understood, and its health system and the reforms we are on, you know, has been much better perceived by the European Union also, and the recommendations with time, having all this information available, the recommendations were much better and more precise and more helpful, of course, to us. So this is super important for us, being small, as I said, and I think, you know, that this is in general important to the countries, you know, it's not just Slovenia, but I think in particular small countries, you know, really have, it's a lot of benefit for small countries to be able to take a part in you know, information and good practice exchange in this way. So being part of this initiative is for us very, very important.
Thank you, Vesna. I think this is a very important point because since COVID-19, I think many experts agree, and also many citizens, you know, that there is a clear role for the EU institutions in health and health systems. But to exert this rule, you need to have a good understanding it, and you need to have good monitoring it, you know, and you need to understand all those countries, whether they are big or small, no matter what language they have. But Vesna, it's also the other way around. I think we learn not enough from countries which are small and have languages we usually don't speak, you know. And I was attending the other day a community of practice webinar on a Baltic country, and they were talking about how they introduced actually advanced practice nurses. And this was something you could really learn from, you know. We all know that we want to have advanced practice nurses, but how to do it is a very difficult thing. And they really had cracked the nut, actually, you know, and I think we need to learn from these countries. Thank you so much for this. And I would like to turn now to Dirk.
Oh, thank you. I think then I'll have the last round of comments. It's quite an honor, Matthias.
No, it will be Kate. Kate will be the last one to speak.
Okay, then we leave the honor to Kate. But from what I've read in the chat box, one, there was this suggestion to explicitly flag out when a reform is, the purpose is to be linked to an EU level initiative. I think we had European health data space, beta cancer. That the more info, the more it helps. So I'm taking this. Yes, please. It's already brilliant, but make it even better. Marvelous. And then there was a concrete question, how would then the reform tracker in practice help for the semester, and how would it help support the member state? I think the first level answer is, for our purpose, writing an analysis of a country in a country report that goes into the semester, and it may lead to a recommendation. Very concrete example is we see this reform is introduced in country A, but we know that this will likely mean that a few years from now, further reform is needed in additional complementary areas. And we refer to the tracker, because now we have an overview for which this is a first level answer. Second level answer is, in the Commission, we have a lot of these twinning projects. For instance, we do a multilateral in-depth review of recommendations in the Social Protection Committee, including in the health area. And there we have one country reviewing another country's reform success on a recommendation. So this is a brilliant tool for this. We can have countries that already had the same reform a few years earlier and said we completed successfully. We twin them, we mix them up. Similarly, we have the technical support instrument, where often this is concretely, and this is also to the question of Boris, to concretely help one level of experts from one country in another member state roll out and take up good practices that have proven to be successful. And this is an excellent tool to inform this process. So thank you. I'll leave it at that.
Dirk, thank you so much. And now it's time to ask Kate for her final comment, actually. But Kate, I was just browsing through the chat box, actually, and people are full of praise of the tracker. They see instantly the the use and the advantages which such a tool is. You must be very pleased about this. But please, Kate, what are you taking out of this discussion, out of this webinar today?
Thank you, Matthias. Yeah, we are very happy with the tracker and how it's going. And I think that the discussion has really proven already the usefulness of the tool for researchers and policymakers. It's supporting knowledge brokering, which is a major part of the observatory, and policy design already, as Vesna has also mentioned. And I think the main takeaway for me is we're on the right track, but there's opportunity and imperative to do much more. I think linking to the EU initiatives, European Health Data Space, such as Dirk just mentioned, is certainly feasible and something to think about. Also, very much linking to the HSPA, or Health Systems Performance Assessment dimensions, a bit more at the higher level. And then, as I found what Vesna said about unpacking government features. So we have a cluster on accountability and transparency, but really thinking about and acknowledging health systems as integral to social cohesion, as you also mentioned, Matthias. And so therefore strengthening the tool in that view to kind of broker and help build trust across these institutions and all of these different players. And so there's a lot to think about. We do have future plans in terms of creating reports around certain, maybe not just even top level clusters, but looking specifically on transparency and accountability. So to add to what is currently kind of quantitative numerical trends, to add contextualization to that. So I think I take away gratitude and also imperative to do more. So thanks.
Great, thank you so much for it. You just launched the tracker and you already have future plans. And I think I can't wait for the champagne once you have 1,000 reforms in the tracker. So thank you so much. Thank you so much for everybody attending this one. Great speakers, fantastic panel, good chat box. We really enjoyed it and hope to see you back next week. Bye-bye.